Hi everybody, welcome to our module on carcinoid tumors. Carcinoid tumors are neuroendocrine tumors, and neuroendocrine tumors derive from neuroendocrine cells, which are cells that have both nerve and endocrine features, and they're found in many organs throughout the body, including the GI tract and the lungs and the pancreas, and the small intestine in the GI tract is one of the most common locations of neuroendocrine cells. The reason carcinoid tumors are called carcinoid is because the word carcinoid means cancer-like, and these cells were named for their slow growth. They weren't thought to be exactly like cancer because they grew so slowly, therefore they were called carcinoid. Carcinoid tumors secrete the neurotransmitter serotonin. This is the structure of serotonin shown at the bottom of the screen. Its formal name is 5-hydroxytryptamine or 5-HT. Note that it has an amine group hanging off of it. It is sometimes referred to as a bioactive amine. And there are other bioactive amines like histamine and catecholamines, and sometimes carcinoid tumors also release those as well. But it is serotonin that's thought to be responsible for the majority of the clinical effects. And the main clinical effects of patients who are symptomatic with carcinoid tumors are diarrhea and flushing. If you ever get to meet a patient with one of these tumors, they are miserable from the frequent diarrhea and the bright red flushing of their skin. The diarrhea is thought to result from serotonin stimulating GI motility. The flushing is thought to result because serotonin causes vasodilation. Some other mediators like histamine are probably important as well. And then the other symptom that some patients with carcinoid tumors develop is valvular heart disease. The serotonin can increase the fibroblast growth and the fibrogenesis in the valves of the heart, especially on the right side of the body in the tricuspid valve and pulmonic valve, and therefore some patients with carcinoid tumors develop symptomatic lesions of the pulmonic and tricuspid valves. We'll talk more about that in a minute. When someone has a carcinoid tumor, we say they just have a carcinoid tumor. However, when they have a carcinoid tumor plus symptoms like diarrhea and flushing, we say they now have the carcinoid syndrome, which is a collection of clinical symptoms secondary to the high serotonin levels resulting from the carcinoid tumor. Now, most of these tumors occur in the GI tract. However, the liver and the lung metabolize and inactivate much of the serotonin secreted from these tumors in the GI tract. This means that a GI carcinoid tumor is not going to cause the carcinoid syndrome unless it's metastatic to the liver. If it's confined to the GI tract, it will release serotonin, which will be inactivated in the liver, and there will be no symptoms. If it's metastatic to the liver, however, those mets can release serotonin, which can now travel and cause symptoms. This also means that there are generally no left-sided heart symptoms because as the serotonin travels through the lungs, it's largely inactivated. The symptoms that occur in the heart are usually symptoms related to fibroblast growth on the tricuspid and pulmonic valves. You rarely see symptoms on the mitral or aortic valves. In addition to diarrhea and flushing, you can sometimes see symptoms in the carcinoid syndrome from altered tryptophan metabolism. Tryptophan is an amino acid. This is its structure shown on the screen, and it is used to synthesize the neurotransmitter serotonin. Normally, about 1% of the body's tryptophan is used to make serotonin. However, in patients with the carcinoid syndrome who have ramped up serotonin production, up to 70% of the body's tryptophan can be tied up in the production of serotonin. This can lead to a functional tryptophan deficiency, and tryptophan is required to synthesize the vitamin niacin or vitamin B3. So when you become functionally deficient in tryptophan by using all your tryptophan to make serotonin, you can then become deficient in niacin or vitamin B3. And the symptoms of niacin deficiency are pellagra, which I talk about in the biochemistry modules, and they can result in patients with carcinoid syndrome from altered tryptophan metabolism. You might think that you could measure the serum level of serotonin to make a diagnosis of carcinoid syndrome, but unfortunately serum levels of serotonin are not reliable and are not useful for the diagnosis. Instead, what you need to do is measure a metabolite of serotonin called 5-HIAA. 5-HIAA is 5-hydroxyindoleacetic acid, and it is derived from serotonin when serotonin is broken down. There's an enzyme called monoamine oxidase which breaks down serotonin into an intermediate, which is then converted into 5-HIAA. And this will appear in the urine in patients who have the carcinoid syndrome. So if a patient has flushing and diarrhea and you suspect that they may have the carcinoid syndrome, you ask them to collect a 24-hour sample of urine and you measure the 5-HIAA level, and if it is increased, that suggests a diagnosis. So we've touched on this before, but patients with the carcinoid syndrome can develop carcinoid heart disease. This results from fibrous deposits on the tricuspid and pulmonic valves that leads to stenosis or regurgitation. As I said before, serotonin is inactivated by the lungs, so left-sided lesions are rare. It's usually the tricuspid and pulmonic valves that are involved. And tricuspid and pulmonic valve lesions are relatively uncommon, so when you do see this in a board question, one of the things you should think about is carcinoid heart disease as an underlying cause. So the classic scenario of a patient with carcinoid syndrome is a patient who presents with abdominal pain from the tumor in the abdomen, flushing and diarrhea from the high serotonin levels, and evidence of pulmonic and tricuspid valve disease. There are a number of treatments that can be used. The treatment of carcinoid tumors is complex. They are often metastatic at presentation. You can surgically excise the primary lesion in the gut if it's localized. Sometimes patients will have their liver mets resected. This is helpful because, as I told you before, the liver mets are responsible for the clinical symptoms. So even if you cannot get all of the tumor out of the body, if you can take away the liver metastases, the symptoms often improve. And then finally, there's a drug therapy you can use called octreotide. Octreotide is an analog of the gastrointestinal hormone somatostatin, and it can be used as drug therapy for certain forms of GI bleeding as well as some other niche roles. And one of those niche roles is treatment of the carcinoid syndrome. The reason it's effective in carcinoid is because somatostatin receptors are found on many carcinoid tumors. So if you administer the drug octreotide, you will inhibit the release by tumor cells of so-called bioactive amines. And bioactive amines are substances like serotonin as well as catecholamines and histamines, and all of these can be released by carcinoid tumor cells. And the important point clinically is that when octreotide therapy is used in patients with the carcinoid syndrome, their flushing and diarrhea significantly improves. The flushing and diarrhea are what make patients miserable when they have the carcinoid syndrome, so if you use octreotide therapy, you can make them feel much better. And that concludes our module on carcinoid tumors.